And now we're lucky enough to be joined by Mr. Karl Briscoe from NATSWA. So Karl, what is NATSWA?
The National Aboriginal and Torres Strait Islander Health Worker Association. I'll use NATSWA just for ease of language. It was established in 2009, and it was part of the Australian government's Closing the Gap strategy, in 2009. It's a professional peak association for Aboriginal and Torres Strait Islander health workers and health practitioners. Just remembering the health practitioner came in 2012, and then we actually were asked to support that profession as well. I suppose the purpose of NATSWA is to promote and support increased recognition for the vital roles of Aboriginal and Torres Strait Islander health workers and the roles that they play within the health system. I suppose, one of the things that our profession does have is they have a cultural intellect, that a lot of other professions don't have. So when they service Aboriginal and Torres Strait Islander families, communities across Australia, they do it in a culturally safe manner.
Is your approach using cultural competency?
When we look at, we've recently seen AHPRA, the Australian Health Professionals Regulatory Agency. They've, endorsed a definition of cultural safety, which their definition is cultural safety is determined by Aboriginal and Torres Strait Islander people. So when our particular profession is Indigenous ethnic-based health profession, and one of the only ones in the world that has national training and curriculum as well as registration that supports its profession.
What are your priorities in the area of cultural approach?
With our profession, we have 4 particular strategic priority areas that we're focusing on to support our profession. So the scope of practice for the workforce is the first one, and that's to look at increasing the appropriate use and the full range of this profession to integrate it into all aspects of the health system. A second approach, a strategic priority area is professional support and development of our members. So the aims is to improve accessibility and the quality of professional support and development opportunities for Aboriginal and Torres Strait Islander health workers and health practitioners. And that's done in a culturally safe environment and manner. The representation and promotion of workforce needs, that's our 4th priority area. So this area is to increase the development and implementation of Aboriginal and Torres Strait Islander health policies and programs that are relevant to our workforce. And then our final area that we are working to support our profession is the recruitment and retention of the workforce. So our role is to influence the development and implementation of recruitment and retention strategies for Aboriginal and Torres Strait Islander health workers and health practitioners.
Is your approach to having health practitioners from their own region?
So yeah, we do, like this particular profession, that's correct, like social and cultural barriers that exist. The training that they undertake is in comprehensive primary health care. So the lens that they put over a particular client is a comprehensive primary healthcare approach. It also incorporates, yes, the social and cultural determinants of health. And generally, most health workers are from that particular community, so they know the family connections, they know the ins and outs as to what's happening within that particular community.
How would you encourage young Indigenous students to go into health as a career?
We see a lot of our professionals that come into the profession that they have either had lived experiences with family members dealing with chronic illnesses, or They've actually had either their mothers or aunties or role models within their communities that have been Aboriginal or Torres Strait Islander health workers. So, they a lot of the times we see them follow in their footsteps. But I would say, especially for the younger generation coming into the profession, it's a really good stepping stone, if you'd like, to go on to either nursing, allied health, or medicine. There is particular pathways that are available for young people that are thinking or not too sure, of where they might want to head. But this is a good opportunity to come into the profession and get a sense of where they may want to head. And we have seen a lot of professionals move on to other professions.
So, what are the challenges that Natsua are facing today?
I suppose, one of our biggest challenges is the professional recognition of this role within the wider health system. We see, a lot of the times it's not really understood or respected their roles, but once people actually realise the work that they can perform, we do see that professional recognition starting to be a lot more respected. In terms of the in terms of some of the other challenges that we're looking to support the profession in overcoming is, trying to influence a lot of the awards and EBAs, and provide advice and information, especially around models of care that are being developed in order to utilise this profession within those models of care. And as well as, promoting this widely throughout Australia.
What is Natsua doing to combat this pandemic?
One of the major pieces of work that we actually took the lead in was the co-branding of a Aboriginal and Torres Strait Islander health professionals resource kit, and that's a series of posters. So we actually called on the Australian Indigenous Doctors Association, the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives, and the Indigenous Allied Health Australia to come together to we facilitated that process to support the development of these particular resource posters. So there's posters that support the health professionals, but also posters that support the community through the rollout of COVID-19. I suppose we've also kept our members consistently updated. So whenever the Prime Minister makes a speech, we do up an update for our members, break down the language, and send that out to our members. As well as the other, I suppose, big piece of work is around, we had an exemplar model of care around a 715, a health assessment. So the Australian government provided video conferencing and teleconferencing item numbers to overlap the face-to-face one. So we actually mapped it out and provided that as actually a resource poster for our professionals to use within the field.
Karl, are we seeing improvements in Indigenous health?
Definitely. We are seeing improvements in Aboriginal and Torres Strait Islander health, whilst it's not as fast as what we'd like. We are seeing, especially in the Aboriginal community control health sector, and students, coming that are thinking about having a career in Aboriginal and Torres Strait Islander health, I really do encourage them to, take up the baton, and it is actually quite rewarding, and self-fulfilling, knowing that you're actually helping people, better their health outcomes into the future.
Thank you so much, Karl, for joining us today, and we really appreciate what you're doing for the mob in your community. We really appreciate the leadership that you have.